1, 2, 3, and let me know how this feels. Ooh, we got some twitches. Feel that twitching?
Yeah.
You're just gonna take this arm and you're gonna place it behind like this. Now we're gonna adjust the suboccipital region.
Relax a little bit more. So I'm gonna have them bend. Look to the left a little bit more.
And bring it into a better posture. Hey everyone, this is Dr. Alex Tubio. Before we get started, if you could please like, comment, and subscribe to this channel, I would really appreciate it. Today we are here with Dr. Marvin Jacob. We're going to be going over something that you might know that you have or something that you actually might not know that you have, and it's called upper cross syndrome.
So upper cross syndrome is something that we see in a lot of our patients. So we're going to talk to you about what causes upper cross syndrome, what are the signs and symptoms of upper cross syndrome, and how we treat them. So stay tuned. So today's focus is going to be upper cross syndrome. It's something that is commonly seen in both of our settings, and we treat it in slightly different ways, but it seems to be very effective as far as what we do for our patients.
So a lot of times whenever somebody comes in with upper cross syndrome, the symptoms are kind of similar in a sense. A lot of people might be suffering from headaches, shooting pains from the neck all the way down into the arms, neck pain just in general, sometimes mid-back pain as well too. Just an array of symptoms in it, and there's a reason why that happens.
So something that we both see in a lot of our patients, no matter what age they are, if they have upper cross syndrome, it's all going to be in their posture. So they're going to have the forward shoulders, they're going to have the forward head, and slightly forward neck posture, which is going to put a lot of stress on their joints, their bones, and their muscles. That's where you get a lot of the tension, a lot of the pain, and even sometimes you'll get nerve compression. So for a lot of you people who work at a desk or have a seated job, you're going to see this posture a lot. For the people in the gym who like to work their front muscles, their push muscles, their pecs, their shoulders, their chest, that's where you see this dominant musculature a lot in the front, and they neglect the muscles in the back. So an example of some of the tight muscles that you'll see in this posture are going to be the pec major, the pec minor, which kind of just run over the chest. You're going to see the sternocleidomastoid, which is a muscle right here in the neck. That's going to get taut because your head is in such a forward position. You're also going to get tightness here in the back of the neck because when your head is in a forward position, you still need to look up. So when you look up, you're going to use these back muscles here. They're called the suboccipital muscles. And you're also going to get tightness here in the upper trap, which runs over your shoulder blade, and also the levator scapula, which helps raise your shoulder blade up like that. Now, some of the muscles you find that are going to be weak and elongated are going to be the mid-trap and low-trap muscles, which help stabilize the scapula, the serratus anterior, which helps you bring your shoulder blade forward. You're going to see some weakness in the deep neck flexors, which help you retract your head and keep your spine in a good posture. Last but not least, you'll also see this in patients who are suffering from depression and have a naturally forward posture because of what they're experiencing.
So normally when it comes to upper cross syndrome, most people think that the way to treat it is just through stretches and through strengthening exercises, but it's a whole other world to it. We can do a lot of other different things such as adjustments, such as dry needling and cupping. Mainly what I do is whenever I see patients that come in here for upper cross syndrome is to do a lot of the adjustments and then go into the stretches and maybe some muscle mobilization as well too, in order to get that upper cross syndrome, one, fixed, but two, to prevent it from coming back again. Now, it's not just a one-time thing, it is a continuous effort, but what ends up happening with upper cross syndrome, and the reason why I really prefer a lot of the mobilization techniques, is because a lot of the joints in your thoracic region as well as in the neck region really start to become locked in, and they become locked up not because of just the joints itself, but also because of the muscles. What ends up happening with upper cross syndrome specifically is that first, that head will move forward this way. So it starts to protract forward. You can see now the muscles will start to tense up as it moves forward this way. Now, it doesn't just locate on the head, but now it starts to do a training reaction into the rest of the body as well too. So as the head moves forward, these shoulders now will start to move forward as well too, creating unnecessary tension in the pec muscles, but also in this thoracic region, paraspinal muscles in the thoracic region, causing what we call a hyperkyphosis. There's supposed to be a curve in the neck, there's supposed to be a curve in the middle back. In that neck, it's supposed to be a 43-degree curve. You usually lose that curve in that neck region as it starts to move forward this way, because you're typing, you might be on the computer, you might be studying, whatever it might be, you're looking down a lot, or you might just be doing a lot of things in front of you. And then with this thoracic region, as it becomes hyperkyphotic, these muscles around it just start to hold that portion together, because your body doesn't want it to increase any further. All right, so what we do here for me is we try to get everything moving again. After we get everything moving, then we start to give some exercises, stretches, and muscle re-education.
And you guys got to remember, this is a long-term process. The posture that you can get from the work environment, from studying, and from working all these muscles in the front is that over a long period of time, eventually the bones, the muscles, and the joints will be in a position and will require some kind of mobilization or manipulation.
So the first thing we're going to show you guys is how we treat upper cross syndrome through adjustments. For me, one of the biggest things is to make sure that we are addressing this area from the base of his occipital region down to this thoracolumbar junction, which is from here to here. I'm going to feel in through this region where I feel the high musculature might be, where it's a little bit more tense, and then adjust and break through that region so we can break through a lot of the fixations here. The reason why that we are adjusting is because a lot of the times with the musculature here, they become stuck. Now, the main objective of an adjustment is to get everything moving in. The reason why that's important is because it allows those nerves to fire back into those regions, allowing for more neuromuscular control, neuromuscular re-education in through that region that hasn't been elicited before. So that's the main objective of the adjustment itself. All right, so I'm gonna do this one in through his thoracic region. I'm gonna slightly press P to A, or what we call posterior to anterior, and push down this way on a region that I feel needs it. So right around this T9, T10 region, you can already feel stuff that's already moving. I'm gonna adjust right in through here. All right. So this is where sometimes it becomes hyperkyphotic, especially right in through here. You can see that this portion is actually sticking up a little bit higher. I'm gonna go right in through here. Marvin, I'm gonna have a deep breath in and exhale out. Good. Good. How'd that feel?
Good.
So we're going to keep moving up in through this region from the T1 to the T7 area. There's a little stiffness, especially right in through here, but it's a little harder for me to get it down this way. But I'm actually going to use a different technique here. All right, I'm going to actually take his head, just come in a little bit closer so that you can actually hear this. All right. I'm gonna bring this up like this. I'm gonna have you lift your head up just a little bit. Good. And now relax this way. And I'm gonna push right in through here. Good. Allowing those joints to move again. Now I'm gonna have you on your back. So the next adjustment that I'm gonna do is on his cervical region. Whenever somebody has upper cross syndrome, a couple of points really stick out to me that might be affected. The first one is between the thoracic and cervical region, between that C7, T1, even C6 region might get locked up. And then also in the top portion, right at the suboccipital muscles between C1, C2, and sometimes C0, which is that occiput. So because whenever you have that upper cross syndrome, your neck is going to be a lot more forward, then you're going to have to look up. So it's putting a lot more tension, especially on this portion here, which is the suboccipitals, and also down into the cervical thoracic junction. All right, so I'm going to adjust this. I'm going to look on this. So for Marvin, his right side is tight in through here. So I'm going to adjust this side. So we're going to adjust this T1, C6, actually C7 region right here. I'm going to turn his head just like this. So I'm going to have him bend. Look to the left a little bit more. Turn your head up. Good. Now just relax a little bit more. Relax these shoulders as much as you can. I'm just going to push right through this here. Here it is. That was big. All right. So now I'm going to go on this left region here. Right between the C3, C4 region. I'm going to adjust right through this over here. Bend a little bit. Good. And just relax a little bit more. Good. Awesome. So another thing that does come in play with upper cross syndrome is compression. So what I'm going to do is just distract these joints in between these regions, just allowing so those nerves can actually run free again to the muscles, to the rest of the body as well also. I'm just going to pull like this. How'd that feel?
It's good.
All right.
Sweet. With upper cross syndrome, a lot of times we'll see the trigger point in the levator scapular muscle or in the upper trap. And so for this demonstration, I'm gonna ask Alex if this is painful when I press on his upper trap muscle.
Yeah.
Yeah, it is. And I can feel it feels almost like a rope, a tight rope in his upper trap. And one of the most effective ways I treat this kind of syndrome, this kind of pain, is with a dry needle. The symptoms can be the pain that you feel with palpation or whenever I squeeze it. A lot of times you'll see patients, or you can even experience this yourself, you'll have headaches, you might even have some blurry vision or sometimes nausea as well. So essentially what I have here is a dry needle or an acupuncture needle. They're virtually the same thing. Acupuncturists, I believe, have a thinner gauge needle than what we use in dry needling. But they're a sterile needle that goes into the area of a trigger point, and what it does is it provides a mechanical input into the muscle. Essentially what it tells the brain is to relax that muscle by going into that trigger point. It also allows for blood to return back into the muscle and to relieve the taut band that you would feel in the muscle. You feeling this right here?
Mm-hmm.
Okay, so I'm gonna go ahead and place the needle in here. 1, 2, 3. Needle's in. And so I'm gonna piston it this way. Tell me when you feel it.
Yep.
Feeling it there?
Mm-hmm.
Good. A lot of times you'll see a twitch in that muscle. Good, and needle's out. And now I can feel that this muscle is already softened up a little bit. It's not as tight as it was before. How does it feel when I squeeze it?
Crazy. Yeah, this is really good.
You feel the relief?
Yeah.
Now there are common points that in everybody that will be prone to a trigger point. So what I usually do is I go along the muscle. So for his upper trap muscle, I kind of just run along the muscle, and I feel other spots that might be tight and painful. There's different approaches that you can take. Some people take the posterior or they approach from the back. Some people take the anterior or approach from the front as well. I like to take the posterior approach. That's the spot on me that I get a lot, and a lot on my patients that'll be painful. Okay, so if you want to go ahead and on your back. So I'm getting the same muscle here, the upper trap, but I'm going to be approaching it from the anterior. Feel that right there?
Mm-hmm.
Yeah. Okay. So come right here. 1, 2, and 3. And let me know how this feels. Feel right there. Ooh, we got some twitches. Got some tight traps, dude.
Yeah.
And then come out. And how does that feel compared to?
Feels much better.
Much better, right?
Yeah.
Yeah. It also feels like it released a little bit there.
Mm-hmm.
Got it all. So a lot of times I get the question what the difference is between dry needling and acupuncture. Now acupuncture has existed for thousands of years. It's more based on an Eastern medicinal approach. There are various types of acupuncture, the practice of acupuncture, same way as there are different types of approaches with dry needling. It started with the trigger point where you put the needle into the muscle. Now it's kind of gone into and expanded into joint spaces, into connective tissues like ligaments and tendons to improve the healing and inflammatory response of a joint and help with the overall pain and function of a person's performance.
All right, guys, so the last thing that we're gonna go over is probably the most important thing of it, and it is the self-care, the things that you can do at home, the stretches, the exercises. So we're gonna go over some stretches. We're also gonna go over some exercises as well, too. All right?
So I have 3 exercises in mind. I show these to almost all of my patients. The first exercise is called a prone retraction. And so I'm gonna have Alice go ahead and lay down on your stomach here. Now you can do this exercise on the floor, you can do this on the bed, you can do it on any kind of flat surface if you have an exercise mat. What I'm going to have him do is, keeping his arms by his side and his head in a nice neutral position, I'm going to have him bring his shoulder blades back and down and hold this for 5 seconds. 1, 2, 3, 4, 5. And then come on down. I'm going to have him repeat this exercise. Going back, keep going here, and go ahead and do some self-counting. So what this exercise is doing is it's strengthening the middle trap and lower trap muscles. It's also helping him do a little bit of a chin tuck. So go ahead and do a chin tuck here. Yep, tuck your chin. It helps strengthen the deep cervical flexor muscles. Now all of these muscles are going to be weak when you have upper cross syndrome. This is one of the first exercises I have that I teach my patients. The next exercise I'm going to show you guys is the thoracic extension. So when you have that forward position from upper cross syndrome, what you want to do is actively extend that thoracic spine to help strengthen it out. The prone thoracic extension, that's going to help out with this. So what I'm going to have Alex do is try to lift his chest off of the ground, nice and slow, and then come back down. Good. And what I'm going to have him also do is tuck his elbows in while he does this and come all back up. And this again is to strengthen that thoracic spine to reverse the kyphosis, the hyperkyphosis that upper cross syndrome puts you in. And I'm going to have them do about 15 to 20 repetitions, nice and slow. So for the prone retraction, I'm going to have them hold this for 5 seconds just to learn it. But the actual prescription of the exercise is going to be at least 6 seconds, 6 to 10 second holds. And I'm going to have them do 10 to start off with. The last exercise is called the prone Y. Now you can do this exercise on a workout bench that's kind of tilted up at a 45 degrees angle. You can also do this on an exercise ball, Swiss ball, and you can even do this at a corner of your bed if you don't have any of those equipment. So the goal of the prone Y exercise is to strengthen the lower trap muscles. Now what the lower trap muscles do is bring down or depress the scapula. And again, this is one of the exercises that strengthens a weak muscle that we see in that upper cross syndrome posture. It's that lower trap muscle. So what I'm going to have Alex do is raise your arms up here in a Y position. Good, leading with the thumbs. And then come on down nice and slow. Good. His focus is to be squeezing his shoulder blades in and down, almost like he's setting them back into his back pockets. The motion is very slow, and he's guiding the whole motion with his shoulder blades. Now if you come in this angle, I'll show you what he's doing with his neck. Every time he's raising his arms up, he's retracting his head and tucking his chin. What this helps him do is strengthen those deep cervical flexors and bringing him to a better posture.
All right guys, so what I'm going to show you are the stretches that you can do. Whether it doesn't really have to be at home, it can be at work as well, using the beauty of it. So with the upper cross syndrome, there are a few points that I think are major to hit. The first one is going to be the upper trap region. We're going to show you how to stretch this upper trap region right in through here. And then we're going to go into it and just really follow into the levator scap, which is going to be right up into this region. It elevates the scapula upwards, right? So we're going to have you stretch this portion, the upper trap, and then we're going to go into the levator scap stretch. The first thing we're going to do with the upper trap stretch is he's going to take his left arm and put it behind his back, right? And then he's going to take this head, move it 45 degrees this way, and then grab his hand on the top of his head. Now whenever he grabs the top of his head, he's not going to grab the side, or he's not going to grab from the top like this. He's going to grab it from the back top, right in through here, and then he's going to push down this way. Now you're going to do that 4 sets of 30 seconds. So you're going to do that on this side, and then do it also on the other side as well too. All right, so the next thing we're going to do is we're going to go right into the levator scap stretch. So after you're here, right, this is the base of it. You're just going to take this arm, and you're going to place it behind like this, and then pull down this way, all right? Same thing, 4 sets, 30 seconds each. You should be feeling this right up and through this region, right up through here. So the next stretch we're going to do is the pec stretch. We're going to be stretching this pectoral region, the boob region. Usually you can do this bilaterally if you're in between a doorway, but today, since we don't have a doorway, we're just going to do it unilaterally, meaning just one side, then do the other side too. All right, so the set and range, reps and times for this is 4 sets, 30 seconds each. Well, I guess 4 reps, 30 seconds each. On one side and do the other side also. So what he's going to do is he's going to place his hand just a little bit above 90. So we're just going to pull it up a little bit this way. He's going to take his left foot. You're going to start up here, and then he's going to actually push down this way into like a front stance, opening this up for about 30 seconds right in through here. Do you feel that stretch? Yep. You're going to do this for 30 seconds. I'm going to have you come back afterwards. Good. and then he's gonna do that again. One thing that I don't want you to do whenever you do the stretches, what I see a lot of people commonly do wrong is they'll take your, actually I'll show you, is that they'll take this portion right here and they won't step in, so I'm gonna have you stand up straight, and they'll actually just lean in like this. Don't do that because it's putting a lot of abnormal strain on that shoulder region, and it's not gonna actually take it's not gonna actually do the right stretch for that pectoral muscle. All right, so make sure that it is straight. You do take that step and you walk into it rather than lean into it. All right guys, so thank you so much for watching this video. I really hope that it helped you. If you guys have any questions, feel free to contact us on Instagram or Facebook at Dr. Alex Tubio. On Facebook, Dr. Tubio on Instagram.
You guys, you can find me on Prime Mover on Instagram. It's PRYMMUVR.
All right, and make sure you guys comment, like, and subscribe to this video. Go ahead and share it on Facebook. I really appreciate it. Until next time, guys, thank you so much.